Greetings, friends and followers. This is Nurses Talking. I am Dale Barcy, and as always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today I have the very great pleasure of welcoming Stephanie Battiste out of California, USA. Stephanie has been a nurse for more than 16 years. She says she's passionate. She's a passionate advocate for patient safety. She is currently the president of the local Association of Perioperative Registered Nurses, and she is a board of directors candidate for the National Association of Perioperative Registered Nurses. So congrats on that, Stephanie.
You.
Welcome.
You. So happy to be here. This is such a great forum, and I really look forward to speaking with you and having a voice of perioperative nursing.
Well, thank you for doing this. But firstly, I always want to know people's why. So why are you a nurse?
You know what? Such a great question. I'm always asking the same question of people. What is your why? Because I think it's so important to understand people's motivation because we really connect as humans. And for nurses, that's interesting. We all love to help people, right? I think that's at the core of what we do is
Yeah.
who nurses are. But I have a little bit different journey to my why. I had a career change in my late 20s. I had a bachelor's degree. I was a school teacher. I was teaching middle school. And I decided to make a career change for personal reasons. And while I loved teaching, it was time for me to do something different. And so when I thought about what that different career would be, I looked and really it goes back to my childhood. My grandparents, my papa and grands from New Orleans, they raised me. And when my grandmother had a stroke in her 70s, my grandfather, my papa, was her caregiver and she was had hemiparalysis and for 2 years she was bedridden. He took care of her. He was not a nurse or a healthcare professional, and she never had a skin breakdown. She didn't have pneumonia, a UTI. Her hair was done, her nails were beautiful, and he was her nurse. And I know it was an act of love, but it was more than that. I knew that I was a caregiver also. I knew that I was a teacher, and I wanted to go into a field that I could really hone those skills and give back to the community. So I think I was just always meant to be a nurse, and I just didn't know it until a little bit later. I also feel, a really strong sense of responsibility to public health and to ensuring that everyone has equitable access to healthcare.
Yeah.
And so it just kind of fit who I am as a person.
Oh, yours is such a powerful why, really. And coming to it as a second career, and I don't even know if it's a second career. It's a one and a half, really. Because as you say, to say, if you're a nurse, you're automatically teaching.
Yes. So true. And that is such a great point. That was one of my whys because I didn't know anything about nursing. I didn't know the clinical side of it. I didn't know what late that I was going to end up as a perioperative nurse. But I knew that once you're a nurse, you're always a nurse. No matter what area you go into, whether it's research or education, whether it's clinical education versus academia, quality, safety. The list goes on and on and on and on, but you're always a nurse.
You are always on there. So you taught middle school, and then you come to perioperative nursing. That's quite a little bit of a shift. But what challenged you?
Oh, wow. Nurses having challenges. Yes, we have them daily, right? Wow, what a question. There's so many challenges, but I think, I want to talk about two because you're right, that transition from I wasn't only teaching middle school, I was teaching in a Catholic middle school. We talk a
Ah,
lot about, and I'm not going to get into religion, but a lot of the values that
mhm,
are taught at that
mhm.
time, that environment. I was very proud to teach those things. And I was often, as much as I was teaching English and literature, I was teaching right and wrong and
Mhm.
ethics, morals, and values. And so I went into this field with those same ethics, morals, and values that every nurse has, and every healthcare provider has. When I got into perioperative nursing, though, it wasn't quite as simple as I thought it was going to be. Going from teaching middle school and teaching, the right and wrongs of things to being
Yeah.
in a space where we were doing right by our patients every day. Everybody that came to work was saving lives and making a difference. But there was some incivility that challenged me. I love everything about nursing. There is a saying that nurses eat their young. Not all nurses, not most nurses, but some do.
Oh,
And luckily for me, in a sense, I had already had a half of a career. I was a little bit older. I had a I was a teacher. So I knew that I could also say that's inappropriate.
yeah.
And so that was a challenge because I didn't expect it.
Yeah.
Now, the bright side of that is I also had absolutely phenomenal preceptors and mentors that guided me through that challenging first year and gave me the support that was needed. Because, like I said, the vast majority of us do and are. We don't go in saying we want to be uncivil. We don't do that. But it's
Exactly.
And I do want to bring up one other thing that's really unique to me, and maybe others out there, if anyone's listening, you may have the same challenge, is I was born hard of hearing. And in my left ear, I'm legally deaf, and I always read lips. So I was able to compensate, and it had never really been a problem until you can't read lips in an operating room. I think we all learned that during COVID. They even made masks that were clear during COVID for
Yes.
people who were hard of
Mhm.
hearing. Thought it was brilliant. Well, it was long before COVID that I went into nursing, and that was very difficult. I had a very rough first year because instantly I was presented with my disability that I didn't realize was such a disability.
Yeah.
Um, and it was hard at first. I had someone say, well, not everybody's meant to be a periop nurse. You're not meant to. Okay, well, we'll see about that. I'm still going to do it. And so what I did is I came up with a few things. I just started my day with introductions of, hi, I'm Stephanie. I'm going to be your circulator, your scrub. Just so you know, I'm hard of hearing. And if I don't answer you, it's not because I'm not paying attention. I probably didn't hear you. Can you just speak up for me? Or just, repeat yourself?
Mhm.
Because I want to be quick and I want to be efficient. And that changed a lot because then I wasn't just, your coworker. They saw me almost in a patient's light, and people really recognized, oh, wait a minute, she's excellent at her job, but she couldn't hear me.
Yeah.
And
Yeah.
and at the time, I couldn't afford a hearing aid because they were very expensive.
Yeah.
I now wear one. It's been life changing, and but that communication piece was really important to the challenge.
Yeah, 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 and that took a lot of courage because to walk into a new environment and have to be vulnerable, an environment like an OR, not just a new environment, an environment like an OR, and have to be vulnerable and allow yourself to be vulnerable is huge.
And to come, as we think about equity and diversity and abilities and disabilities, that vulnerability, but finding a way to talk through it and connect with people and figuring out, how do I fix this?
Yeah.
It's not the hearing aid, I can't afford it, or I don't want you mad at me, and so you're going to yell now. No, it's just preemptively saying, here's where I am, here's what I do, this is what I need of you, and giving an
Mhm.
actionable request that's
Yeah.
reasonable can
Yeah.
really make a difference.
Yeah. 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 And just for someone who might be listening, who's not sure, we say perioperative nursing. What are you talking about?
Oh, that's such a great question. Thank you so much for asking it. So, perioperative nursing is often uh, confused with just operating room nursing. Perioperative nursing is actually everything in the perioperative procedural space, which does include peri-anesthesia. While they do have their own association, it is still within the purview of perioperative nursing. It's also interprocedural spaces that are, quote, maybe smaller, like a pain procedural case or endoscopy
Mm-hmm.
or IR. And then of course it's also those big cases you think about, like transplants and open belly cases and big cases. It also incorporates things like, especially in California, we have tech roles. We have spaces that are not clinical, like our sterile processing department.
Mm-hmm.
That's part
Mm-hmm.
of clinical nursing, but our nurses generally are not doing any clinical work
Mm-hmm.
there, right? But they support us. So there's a lot of ancillary support services, anesthesia tech supporters, or our CRNAs. So it's all encompassing of anything in a procedural space of clinical care.
Thank you for that explanation. So, but I see though in all of this that your particular specialty was pediatric cardiology.
It was, yes. So can I just tell you a little bit how I got into perioperative
Sure,
nursing? All right. I
sure.
like stories, Dale. So if I go too long, just reel me back in. When I was in as a second, degree, I was in an accelerated nursing program and I was in my fourth semester and I did not have a perioperative rotation. To this day, a lot of academic organizations do not have perioperative as a course. Some have it as an elective. It's not mandatory everywhere. I didn't have even an elective option. And I wasn't sure if nursing was for me. I thought, oh no, maybe I made a mistake. I'm almost
Mhm.
done at
Of
second
course.
career. And I was questioning myself. And I had a pediatric patient. I was in a peds rotation, and they were going to have a very, quote, simple procedure, an elbow pinning. And I said, well, can I go? I've never been in an operating room. And I was able to follow my patient through the pre-op area, the operating room, and the post-op area. And what I saw, perioperative nursing found me on that day. And I just said, are you a nurse? Are you a nurse? Are you a nurse? And I just fell in love with it. From that day forward, it was love at first sight. And so I was lucky to go into a Periop 101 residency program because you can't just pick up the instruments and go. And it was a comprehensive, phenomenal didactic classroom skills program. And then it was adults, and I learned to scrub and circulate every service. And then I happened upon cardiac, and and I happened upon it when an adult patient who was not meant to be a cardiac case became a cardiac case.
Ah,
And it was a little more chaos than I expected at the time. But again, cardiac surgery found me. And I fell in love. My nurse manager came and said, oh, we're so sorry. You're still training. This is not the experience you should have had. And I said, that's okay. Sign me up tomorrow. And so I went into adult cardiac. And then and about a year after that, I went into pediatric cardiac. And I had not ever done pediatrics, but it was mostly adults. And I fell in love with the pediatric, what we call pediatric CVOR. And and again, that became my new professional love. So I've fallen in love with nursing a lot throughout my career. And I've done both. I've kept my clinical skills with pediatrics and I've done everything in pediatrics. But my clinical specialty was pediatric CVOR.
awesome, 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 awesome. I love it. And this is the thing about nursing. It is so exciting. And and sparks so much curiosity and so much challenge. I love it.
Yeah. Yes, there
Yeah.
is nothing. We all have our specialties that we love, and we need every nurse out there doing everything we're doing. There's certain things I don't think I could ever do.
Oh.
but
Mhm.
there is nothing like holding, literally holding a heart in your hand, doing a transplant, watching a reperfusion of an
Mhm.
organ. Most people don't see the inside of a body
Yeah.
ever.
Uh-huh.
And I've seen all of the parts and I've felt all of the parts. And, 16 years later, you can tell just how I talk about it. It's
Yeah.
just such a fascinating field.
Yeah. Yeah. Yes. It actually is such a privilege just to be there, just to be there. And let alone be a participant, you know? Yeah. So you say that you mentor and you precept new grads. What do you see as the most pressing need?
Oh, wow. Well, just that is mentorship and a formal preceptor residency.
Mhm.
So I have both in my professional career as a job done Periop 101 and new grad training
Mhm.
and or cross training. I've overseen that, and I'm currently working as a I call myself a leader. I'm technically a manager. I don't believe in managing. I like to lead. So I'm a leader of a team of 11 nursing professional development specialists and tech educators over perioperative space. But I also personally give of my time to any nurse or student interested in either becoming a nurse or perioperative nursing through mentorship. And I think that those of us that can and are experienced, whatever area of nursing we're in, and like you said, at whatever point in our career we have a responsibility to give to up and coming nurses, students. I've even mentored medical students. I've done interview skills and practice. We don't learn how to practice interview skills. We don't learn
Mhm.
how to start a new career after school.
Yeah.
And so really giving people a safe space to ask questions, to find out, well, what is perioperative nursing? How do I get into it? Do it what I
Mhm.
want? It's a really big career change to not know anything about. So I do it with many hats. I do believe that any nurse student needs to really learn about their field. You don't learn the clinical skills of everything you're going to do as a nurse in school. And so, one, you need to know, is that the right place to go? Because we don't want our nurses leaving after 1 or 2 years,
Yeah.
which still
Yeah.
happens.
Mhm.
you know,
Yeah.
and two, organizations themselves, talking about the actual employment organizations, need to really invest in structured residency programs. The literature, it all states that having a structured residency program that provides holistic support for new graduate nurses increases their retention
Yeah.
and their skill set and their
Mhm.
quality of care.
Yeah.
So we know this. I would love to see it in every organization out there. So those are the two things that I really believe in, and I support personally and professionally. And then to put on my AORN hat, my association hat, I also empowered our local chapter, and any nurse that is in any association or sits on any board. I really implore you to consider offering your meetings and your resources for free to students. And
Mhm.
so, national organization, we do that. Our expo is actually free for students to come to. My local chapter, we made all of our meetings free for students. And that's where they meet people. That's where I
Yeah.
often say, if you want to call me, let me know and I can help you with your resume or I can help you with interview skills. Or they just find out about your specialty and they're more likely to go into it.
Mhm. Exactly. 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 So tell me though, um, if someone came to you who's and said, "Listen, Stephanie, I would love to be a nurse," what advice are you gonna give them?
Oh,
Or at least I'm
I
thinking about it.
I do that. I have people, that ask me that. I have high school students that I've discussed it with, and I say, well, one, how much time do you have? Do you need the the really quick version, or do you want to go have coffee?
Mhm.
And then I talk about their why. I think there's many people go into nursing for many different reasons. And all of those reasons are great. It doesn't
Mhm.
have to be deep held passion, for caring for
Mhm.
people. It could be stability. It could be a path forward, financially. That's okay. We have a code of ethics. You still have to abide by them. You have to get your
Right.
license,
Yeah.
if and so understanding their why and really getting them to understand their own why, because nursing is difficult. And while it is the most rewarding career that I believe that you can have, or one of them, it is also one of the most difficult careers and professions that you can go into. And so you have to go in eyes wide open, and you have to understand what it is you're getting into. And you have to realize that this school is just the first part. You got to get through, and you got to learn all of the didactic and, all the theories and the science and anatomy and physiology. And then you have to take your NCLEX, and then you have to get a job, and then you have to go through residency. And, I had someone tell me when I was early in my nursing, you just wait 2 years and then you'll start to feel confident. And I thought, wow, 2 years? Wow. I'm 16 years in, and there's some things that I'm saying, I should probably learn that. Or, or now I can say I'm a subject matter expert at something. It's a lifelong process. I would tell them it becomes part of who you are,
Mhm.
and it's going to be really difficult, but it's going to be worth it.
Yeah.
So,
Yeah. 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 And you said something really, really, really important and profound just now, because you were talking about understanding their why, but then you said getting them to understand their why. Huge.
at any stage in our careers, in our life, is we talk about it at our dinner table, purpose. What's my purpose? And it could be my purpose today. It could be
Mm-hmm.
my purpose in this interview. It could be my purpose with my association, or it could be my purpose with my career. But we
Mm-hmm.
all understand our own purpose so
Yeah.
that we can fulfill it.
Yeah. 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 And that sometimes escapes us. So what do you do? We're talking a lot these days about, burnout and all of this.
Hmm.
So I need to ask you what self-care means to you and what do you do to care for you?
Yes. Oh my goodness. Well, I'm not going to say I'm perfect, because I do struggle with that myself. I think the first thing is really acknowledging it's an absolute, that we must, in anything we do, we must take care of ourselves. I could go through the old cliche of put the mask on yourself first, or
Mhm,
care for
mhm,
yourself
mhm.
first. We can't care for others if we're not caring for ourselves. Well, we actually can't be the best version of ourselves if we're not caring for ourselves. Um, I have a lot of things that I'm working on. I am constantly saying yes. I am constantly saying, oh, is that another certification I can get? Um, or is that another class I can take? And I've just started to really recognize recently that I have to start saying no, or not right now, or maybe later, so that I can make space for that self-care.
Yeah,
And self-care comes in so many forms. Physically, I have some knee issues, and I've had multiple surgeries, and I actually have not quite recovered from one that caused a lot of nerve pain. And my newest self-care focus is, how do I get into the best, physical shape, that I don't need a knee replacement too soon, too young.
mhm,
I pause to say, you know what? It's time to go outside and go for a walk. Even, self-care can be really small. I had a colleague today who said, hey, will you walk outside with me? And I just saw her face, and I thought, yes, I can,
mhm.
right? Like, let's go walk in the fresh air. And
Yeah,
it helped me too. It was 30 minutes. We took a break and we just got outside. It could be deeper. It could be, I'm going to do yoga 3 times a week, or I love to read. It's, I'm going to just read today.
yeah,
Um, I personally, I love two things. I love to travel, and I love to bird watch. And so I always have my binoculars on me. They're a little pair,
Yeah. Hmm.
and I take them everywhere. And sometimes I'm very fortunate. I have a beautiful home with a lot of birds in my yard. Sometimes I just take a little time if I'm working from home and I go sit outside and I watch my bluebirds. Um, so really, I think the message I would have to all of us that I'm constantly still telling myself is we have to recognize that one, we are human and we have to take care of ourselves. Um, and two, doing the best we can to give ourselves grace so we can do it in whatever capacity that is, small or big.
Yeah, yeah, absolutely. And that, that's the reason that I asked that question, I ask it of every single person, because I think that we need to articulate it. And you talked about um, you know, knowing what you need. Because if you don't know and taking care of yourself, if you're not taking care of yourself, you don't actually know exactly who you are all the way through.
Yeah, so true. Absolutely. So
Yeah,
true.
yeah. So, Stephanie, thank you so, so, so much for this conversation. It has been thrilling. It has been thrilling. I've loved talking to you. Are there any gems you'd like to leave us with?
Oh my goodness. There's one little gem I have that I think I am really excited
Uh-huh.
for the future of nursing. I'm excited to be in a space that I can give freely of my time to mentor and help others and uplift them. I'm getting to a point where my greatest accomplishments are not what I do, but how I help others do. And I hope that we all really embrace the future of nursing because AI is coming. I'm excited for it because we have to be at the table of the innovation,
Yeah.
not just accept what's given to us, get out there out of your comfort zone and go embrace it and learn about it so that we can drive the implementation. I think that's going to be so valuable coming up in the future. And really, if you can, not everybody can, and I respect that, but if you have the opportunity to help our profession grow in any way, I implore you to do so. And if you're new and you want to reach out to me, whether it's on LinkedIn, however you'd like to reach me, and if you need a mentor yourself within my capacity, I would also love to help. So I'm proud to be a nurse. I love perioperative nursing, and I just want to thank you for doing this, Dale. It's such a great forum. I've really enjoyed it.
Thank you. I have enjoyed having you, and I really do enjoy doing this. So thank you to people like you who consent and generously give of your time to talk to me. So thank you so much.